Jai Hind. US and Argentina has announced decision to withdraw its support from WHO. Do you know what are the reasons for withdrawal and what consequences would it lead to global healthcare infrastructure? If not, then stay with us till the end of the video. Let's see how WHO is making difference to global healthcare map. WHO support health efforts across the globe for various healthcare activities such as fighting against malnutrition, HIV, maternal and child healthcare program, vaccination program, and various other healthcare initiatives. More than 194 countries are part of the WHO, and WHO provide them technical assistance and coordinating the efforts of healthcare emergencies. COVID-19 is one of the best example for this, and that is the core reason for withdrawal, which we are going to see further. Over the years, WHO has helped the world in eradicating smallpox and also significantly reduced the case of polio across the world by 99%. They have greatly reduced the prevalence of malaria and also trachoma, which is a leading cause of blindness in the world. So let us see what are the reasons for withdrawal. US and WHO are considered one when it comes to global healthcare issues. So let's see what are the reasons mentioned by WHO for withdrawal. The first reason for withdrawal is mismanagement of COVID-19. US has alleged WHO for delayed intervention and diagnosis about the mode of transport for the virus. They have also mentioned about perceived biasness towards few nations and lack of independence from political pressures. It has also mentioned that there is a disappropriate level of investment from US and that is leading to domestic implication, which is not aligned to the US policies. Similar decision was taken by President Donald Trump in his previous charge in year 2020, but that was reversed, and I hope this is reversed too. US is not only the country who has alleged WHO for COVID mismanagement, but there are many other countries. Let us see what WHO has done for COVID-19 management. Initially, COVID-19 as a pandemic was not informed to other nations. There was an inaccessibility of data from China. Precautions and sealing of boundaries were not announced timely. There was perceived biasness towards distribution of vaccines which were claimed by various countries. If we see the better side of the COVID, then vaccine development was the most efficient part of it. And this vaccine was developed in the shortest span of human history. Deployment of medicines and vaccines was prompt. So we have seen COVID-19 and domestic implication is one of the prime reasons for withdrawal. Let us see what impact would this withdrawal lead. So US contribution to WHO is 1.2 billion US dollar, which is around 15% of total fund. Though Argentina is not a big contributor in terms of finances, but they have a regional role to play for healthcare initiatives. So what are the immediate consequences one could expect out of the withdrawal? Disruption in the funding for healthcare projects. All the projects related to malnutrition, HIV, maternal and child healthcare, vaccination would be hugely impacted. And there are various news which are being already circulated and potential setback to developing country who get support from WHO. You're reducing the influence of US and Argentina on global healthcare policies. US and Argentina would also be facing some domestic consequences out of it. So what would be the consequences? They will reduce the access to international healthcare data and early warning signs. Potential isolation for handling global healthcare threats, and in long term, it would also damage the credibility of US and Argentina on global healthcare map. As 194 countries are part of WHO, so this withdrawal would definitely have an international impact. So let us see about international impact. China role in global health diplomacy will definitely increase. If you see, there are already news floating about this. Expansion of China influence in terms of funding and leadership role. Argentina alignment with US signal. This may also lead some new forum coming out of it. Potential shift in terms of global healthcare governance. WHO is taking care of various healthcare issues across the globe, and all these projects are funded. And the funding would disrupt, this would seriously affect the functioning of WHO. These two withdrawals are already being announced. So what do you think? What would be the future of health governance? So definitely there would be a potential reform within WHO to address the criticism. And the other countries would come up in replacing the vacuum to fill the leadership roles. This would also initiate new alliances and collaboration within the countries for healthcare needs. What would be the timeline for withdrawal? So though US has announced the withdrawal, but financial liability of US will remain for another 1 year. Let us see how WHO has responded to this withdrawal and criticism. WHO has clearly mentioned that despite of any decision, they will be continue focusing on fulfilling the healthcare needs, and they have called for unity and cooperation in handling global health crisis. This is the snapshot of the response made by WHO in terms of withdrawal. The impact of withdrawal has already shown the color, and there are various news articles you can see across the globe published in various developing countries regarding how the withdrawal of US is leading impact to these countries. So at the end, I want to say that this collaborations matters for health and well-being of millions of individuals across the world. So this decision should be reconsidered and reversed. If you are with me on the same page that US should reconsider and reverse its decision for withdrawal, then do type in the comment box with reconsider and reverse. Thank you. Stay tuned with us on the hospital update.